Hi, I'm Dr. Curley, and thank you for joining me today. I'm going to make you a big promise. Follow the advice that I'm about to give you, and your life will improve. Now you might ask yourself, how can you make such a big promise? Well, I'm willing to bet that if you're on my website looking for a solution to the problems that you're having with your mouth, that they're controlling more of your life than you even realize. And second is proof, evidence. I treat scared patients, and when I do, their lives improve, oftentimes dramatically. It happens over and over again, hundreds of times. In fact, I've yet to treat a scared patient and their life not improve in some way. Your self-confidence is probably suffering. You may even have become somewhat used to the pain, but part of you is unaware of how these problems are affecting the rest of your body and likely the rest of your life. If you have chronic pain, the picture looks even a little worse. Many studies have been done on patients who suffer from chronic pain, and what researchers have found is that these patients have lower levels of a natural chemical in our brain called endorphins. Endorphins are our brain's feel-good chemicals, so to speak. And when patients have significantly lower levels of these chemicals, we are much more likely to suffer from depression, low self-esteem, other problems, cognitive problems that generally bring you down. In my free report, you'll learn how the pain and the problems that you're having with your mouth has caused you to choose food that lacks nutrition. You'll learn how this can ultimately make you fat. You'll learn that this process, essentially this lack of being able to digest food, will ultimately shorten your life. You'll also learn how to make your very own transformation happen, step by step. You need this, and you deserve to feel better. I'm sure you've heard of family, friends, coworkers, maybe even you've been sedated for a medical procedure in the past. As you know, it's very common in medicine. They've been sedating patients for procedures that could potentially be uncomfortable for a long time, and they have a wonderful track record of doing that. In dentistry, we don't have that track record, but certainly we're moving in that direction. And in my office, it's routine. You wouldn't consider having your tonsils removed without sedation, for example. But move just a little bit closer to the front of your face and your mouth, and you know, the situation changes. Well, no, we're going to take care of the fear and concern that you have with sedation. So don't be embarrassed. There's no reason to be ashamed that you need sedation to have your dentistry done. I have one more promise for you, and I mean this from the bottom of my heart. You will never be judged for anything going on in your mouth in my office. I'm not here to make you feel bad or lecture you about things that maybe could have been done differently. 100% we are here to help you move forward, get your smile back, get your mouth healthy, and get on with your life. Now I know you're scared, and that's okay. We have the medicine to make it go away. And once we do, we can get the process going of building your smile again and getting your life back. I'd like to leave you with a few quotes from a famous guy named Ralph Waldo Emerson. Mr. Emerson was a transcendentalist, by the way, which is the name of my practice, Transcendental. You'll hear more about that later. But he said, "A great part of courage is the courage to have done the thing before." So congratulations on taking this first step, having the courage to do it. He also said, "He who is not every day conquering some fear has not learned the secret of life." Always do what you're afraid to do. Some profound words. I encourage you to fill in your name and email address in the box on the right-hand side of this page and get started. Good luck, and I'll see you soon.